Now, according to a recent independent audit published by the HSE, almost 70% of hip surgeries carried out in 2 children's hospitals over a 3-year period were deemed unnecessary.
That is just a huge percentage. Joining us now to discuss their child's experience of receiving hip surgery are parents Kim and Mark Mooney alongside their fabulous and stylish and wonderful daughter, Chrissy. Hi, Chrissy.
Good morning.
Look at those for fabulous shoes. Look at those. The leopard print shoes. We're matching today. We're so happy. So Chrissy's going to be here. We're going to have a chat with Chrissy in a minute because you're the best, aren't you?
Yeah.
She is. She knows she's the
it.
best. She's so fabulous.
Yeah,
Kim,
she's brilliant.
Can you tell us what happened, what age Chrissy was, and what happened when she was diagnosed with hip dysplasia?
Yeah, so Chrissy was a late diagnosis, which meant by the time that the hip dysplasia was found, she was too far gone for kind of casting or bracing that would usually correct the dysplasia. So she was over 13 months when it was found, and it was bilateral, so both hips, and quite mild.
OK, this was in 2021?
Yes. Yeah.
Right, OK. So that happens.
So what was the initial diagnosis then, or what was the initial treatment?
So at the first appointment, it was going to be a wait-and-see approach because it was a very mild hip dysplasia. We would just come back every few months, have a little assessment done and see where we were going. So we went back then at the next appointment and it looked like the hips were healing really well on their own, and they decided, you know what, we won't do any surgeries, we'll just, again, wait and see. The next time we went back for our wait-and-see appointment, it turned out then that actually, yes, these hips need to be done, and they need to be done as a matter of urgency. So we were referred then, we were on the waiting list. And in the meantime, while we were on the waiting list, we were called back to our hospital again for another appointment. And at that point, it was found that she didn't need the surgery. So she was removed from the waiting list for surgery. And again, we were having a wait-and-see approach. And at the next appointment, it was found, no, actually, these hips aren't healing as well as we'd hoped, and we were going to operate.
OK, I'm loving Chrissy looking at herself in the monitor. Chrissy, you do you, looking at all her angles. The girl knows what she's doing. She's fantastic. Mark, this is, like, my head is swivelling, like it's like a tennis match of what's going on with Chrissy's hips. Over how many periods of time were you doing the wait-and-see approach that, no, she needs it, no, wait-and-see, no, she needs it? How long was that over?
Probably over
a year and a half.
A year and a half.
OK. Could I just ask you, what is the problem? What exactly is it that's wrong with the hip?
It's like an immature hip socket, so it doesn't, like, you know, the socket should cover the joint. In Chrissy's case, it didn't, so it was slightly out, mildly out. So the hope was that, you know, as she ages, it would start to cover the ball socket and we wouldn't require surgery. And for a little while, it looked like that was happening. But then on the last appointment that we went to, it just wasn't happening at the rate that we would have hoped.
Because during this, there was times, Mark, when Chrissy wasn't walking, she wasn't meeting milestones, right?
Exactly, when she was small,
Yeah, she wasn't.
She wasn't meeting milestones, and then, Kim, she was.
She started to walk then. She was a bit delayed, but she started to walk. But, you know, a child walking doesn't indicate that they don't have hip dysplasia. It's really, most children with hip dysplasia will walk, even if it is delayed. It's more on the angles on an X-ray that you see where you see the problem, you know.
Because I've been listening to lots of people and lots of parents who are involved in this, and there always seem to be, let's wait and see.
Yeah. And which is what you want.
Which is want to see. It's
Absolutely.
like, it might just solve itself, correct itself.
And cases it
and
does.
so that was a case of it.
Yeah.
But then when they did say to you then, no, this is not happening, and we're going to do the surgery,
yes,
then there must have been some relief then. They're going,
of course.
Well,
absolutely.
Our Chrissy's going to be, get the operation and it's going to be healed and she's going to be able to walk properly.
Yeah, we were delighted. We were thinking the sooner the better. You know, it's kind of, we waited and see for the year and a half, and we were ready then for her to have the surgery and to, you know, to recover and to not kind of be started primary school where, you know, it would be noticeable if she could start in a wheelchair or on a walking frame. So we were quite happy that we were being rushed forward then for the surgery.
Because you were fast-tracked.
Yeah.
So the description of what the operation, as to what it was going to be.
Yeah.
What were you told about it, and what was the outcome?
Very little, really. We knew that the surgery she was having was a new way of doing the surgery, which meant that she didn't have to be in a cast or a harness afterwards.
Right.
obviously since we've learned it was quite a novel procedure, we didn't fully understand that. We just thought when they said this is the new way of doing it, we felt it was the way every child was having it done going forward.
The only way that was going forward.
Yeah, that's how we
felt. Because it's a novel technique. They were trying something new.
They didn't really explain it like it was new. It was just the new way of doing it.
The new way of doing it.
And it would have been a keyhole surgery as well.
Yes.
But that's what they told us, a keyhole surgery. But when we seen the scars afterwards,
it didn't look like keyhole.
It was like an inch or 2 inches on each hip, like.
Yeah. Quite substantial and a good few stitches on each side, and we just weren't prepared for that at all because the plaster stayed on for a week, and when we went back to the dressings clinic and when they took them away, like Mark lost the feeling in his legs. We nearly fainted. We couldn't believe. We were expecting 2 tiny little holes in the hips.
When they say keyhole.
And it wasn't that at all.
So as parents, you're just...
They're taken aback. Like,
shocked. Yeah,
it's your baby.
Yeah,
absolutely.
Exactly.
And she was tiny,
and she was chewing enough at that stage as well.
Yeah.
Between being tube fed and having an NG
Why
tube.
was she being tube fed at the time?
She had failure to thrive as a baby, and the X-ray results, the swallow study showed that she was swallowing in on her lungs, and she had a cow's milk protein allergy. So for safety, we stopped feeding by mouth, and she was fed by tube, and then we had to slowly introduce oral feeding. So she had, had surgery prior to that to have a feeding tube put into the tummy. And she had a lot of medical trauma associated with that. She never wanted to go near the hospital. So we wanted the surgery done quickly to get her over, to be done with it, to not have all these extra appointments.
Look at her.
She was a complex case,
Yeah,
Kim.
very complex.
You must have been at the end of your tether. Like, you just must have been living on your nerves for years.
We were, and every time we went to an appointment for the hips, like we explained, her trauma, because even to have an X-ray done was a nightmare. She was terrified. She would be screaming. She would throw up all over herself. And we had to go every 3 months and have that done. So we just wanted it over and done. We wanted to be done with that side of her medical problems. And
I suppose we're looking at Chrissy here.
Yeah.
Like, look at her.
She's so perfect.
Is she thriving?
She's amazing.
Yeah, she's thriving now. Absolutely, yeah. She's eaten by mouth. She's had the feeding tube removed this year.
Just this year?
Just in January, yeah. When she started primary school and all the children were having their dinner in school, she started to eat. So she healed herself.
That is steak.
She loves the steak and broccoli, yeah.
She looks straight up at the steak. Vegetarian curry, any chance of a bit of that?
She loves that.
Oh, lovely.
Like that. Okay, you can stay for that. I mean, so... Luckily, she's brilliant now.
Yeah.
So when you heard about this report and this audit and the survey that 70% may not be necessary, what were your initial thoughts?
For us, we kind of felt we were sick, like we were traumatised. We were saying, oh God, what if she's one of those children? We don't know if she was. Maybe she required the surgery. I don't know. We do recall a conversation with our doctor where he said, if she had have been referred to Crumlin instead of Temple Street, that they never would have done the surgery because her case was mild and Crumlin liked to use a wait-and-see approach, which I suppose is relevant now because we see that in the report.
But at the time, would you have said, oh no, I prefer she had the operation? Were you saying, or aren't we lucky we're in Temple Street?
Yes, we were saying, aren't we lucky? Because we were thinking, we have to do this every 3 months for the next, I don't know, till the growth plates are completed when she's 11 or 12. Can you imagine the trauma of every 3 months taking Chrissy and holding her down while she's throwing up on herself to get an X-ray and then being told, yes, she needs it, no, she doesn't. We were so relieved. We were saying, thankfully, we've been sent to Temple Street. She's going to get the care she needs here. She's going to have this surgery, sooner rather than later, she'll start primary school and she'll be fully healed.
Yes.
So we were thrilled, really.
And she, again, you can just look at her. She just looks fantastic.
She's perfect, yeah.
But I can just imagine that your experience at the time is now very much skewed because you looked at your daughter who was in pain.
Yeah.
Who she regressed after she'd had the surgery. Did she regress?
She was back into nappies because, she had to lay flat. She couldn't stand, she couldn't bear weight.
How long did that go on for?
Probably a month or so. She lay on the sofa for 2 weeks. She wouldn't even trial getting up. She just knew there was something wrong.
She had hip surgery.
Yeah, and even though she didn't fully understand it, she knew she couldn't stand, so she didn't try. And then she suffers with cyclical vomiting. It's just a condition that she has. And just the trauma of it all, and I suppose the anaesthetic and everything, it knocked her into a 9-week cycle where she vomited every tube feed we gave her. morning, noon and night for 9 weeks.
And what did the doctors tell you at the time before she went to surgery, what the aftercare would be? Did they say, like, it could be a month lying flat on her back? Or what was this? What
we
did
were
they
told,
say?
like, you know, she'll be fine. She'll stay for a night in the hospital just to manage.
One night?
One night is all she stayed.
Yeah.
One night. They told her she'd stay one night and the next day she'd be home and she'd be up on her feet and, you know, give her a few days and she'll be running around the house and everything will be fine. So we didn't even book time off work. We just thought, that should be fine, like, we'll continue our routine, and it just wasn't the case at all.
Bonkers for hip
Yeah.
surgery.
Yeah, I think it needs to be, parents need to be more aware of the recovery. And I thought, you know, we had a very good recovery. That was a really good recovery. We had no complications. We didn't have to go back into hospital. She got up and she walked, you know, after a few weeks. Obviously, she did have a lot of setbacks, but there's parents who did have to go back to hospital whose children required more care. So we were lucky, really.
Again, you don't know if she needed the surgery or not yet. This has skewed your whole view on what happened to Chrissy's life when she was 1.5.
Yeah, yeah.
What would you like to say to the HSE about what's happened over the past few weeks?
I just think that they need to communicate better with the parents. We have never been contacted other than the initial letter that explained there was an audit taking place. There's not a single parent who's been contacted to say, you know, whether their child was or wasn't part of the audit. If, you know, they've sat on this, you know, preliminary report for a very long time where they could have had those, you know, children contacted and reassessed. They have done nothing. We don't want to be called back to Temple Street to see the same surgeon to have our review. We want it done externally, like we're requesting to be seen by an external doctor. We want to be able to ask the questions from somebody else. I just think in the interest of fairness, we need to be spoken to. Someone needs to contact us. We've rang the helpline. The poor chap on the phone read from a script. He didn't know what to say.
I'm hearing that they just have a statement that
He
they
can't say anything.
They can't say anything.
No, and I felt sorry for
you
them.
don't want to go to the surgeon, do you not?
No,
you don't
I
want to go
don't.
back to that
I've
surgeon.
lost
Would you not
faith.
like to face him and go, was Chrissy's surgery necessary?
I would like to ask him, but I would like someone to do that on my behalf because I don't have it in me to ask him. I don't think I could sit there while he gave me that answer. And I don't trust that he would give me the answer.
The right answer.
Yes,
Exactly.
yeah.
So you want
someone advocating for ye,
Yes.
who knows what they're doing, what
Yeah.
they're talking about.
Yeah, we
Again,
need a parents advocate. We don't have one. No one has stepped in on behalf of the parents. You know, everything is to protect the hospital and to protect the surgeon. Where's our support? We have no support.
she's fabulous.
Thank you.
She is fabulous. Do you want to say hi to your class? Do you want to say hi to your teacher?
Yeah.
Where's
Hi.
Teacher Amy. What
Hi.
about Novi?
Hi, Teacher Amy. Hi, Novi.
No, she just wants to say hi to her cousin Novi.
Oh, hi,
her
Novi.
best friend.
It's my
It's her
sister.
sister.
their sister? And you're in school in Navan, educate together. So hi to all of them as well.
Give them a big wave.
Big wave.
Chrissy. There you go.
Hi.
Big
Hi.
wave.
One.
So
she's like the leaps and bounds you've had since she's gone to school.
Yeah,
Like
yeah.
I can just see how, like, Mark, you're just staring at her.
Oh,
She's
yeah.
fantastic.
Yeah, we're
It's
just
the business.
She's fantastic.
She's
The
amazing.
school have
So,
been amazing. So
obviously,
very-
you're waiting on some response now,
Yes.
and you need some clarification
Yeah,
of this.
we've reached out to Children's Health Ireland for a statement. I don't know if we've got that yet, but Kim Mooney and Mark Mooney, parents of Chrissy, who is fabulous.
Thank you
Chrissy
so
Mooney.
much for having
Thank you
us.
so much
Thank
for
you
coming
so
in
much
and
for
talking
coming
to
in.
us about your experience.
Thank
we really
you.
do appreciate it. Thanks so
Very
much.
Thank you.